to be able to meet so many people from UNESCO here together. I have other people been working for for a long time already working with the representation of Brazil to UNESCO. I had the pleasure in 2009 in Chile to propose, and we had the fortune of organizing the South American Council on Health. And, well, I'm going to be speaking in half Portuguese, half Spanish, broken Portuguese and broken Spanish. I apologize for my mistakes, but I trust that the will to communicate ourselves will overcome the linguistic challenges that we might have between Spanish and Portuguese. I have 3, 4, 5 big friends here. Luckily, I want to mention actually the ones who have actually white hair. It would be very easy to see if we were in during Carnival, we would be. A samba school made up by actually by the gray-haired people, silver-haired people. We would be very, very, very successful among young girls because of our experience. I want to thank my friend Temporano Alejandra for having invited me to be here. I want to thank Dr. Juval for allowing me to participate in the discussion together with you. I will try to speak shortly. I don't know if I will speak actually just as, we don't know if I'm just going to be making a short presentation. We'll talk about the promotion in governments and social in health determinants in health. I believe that we have to be focused on this issue. It was very unfortunate not to be able to hear to my friend Oscar this morning. It was a good luck too, because if I had heard him, I would be very nervous because I want to say so many smart things and beautiful things that he did this morning. So it's better for me not to having heard him because he's a great influence on me. When I hear him, I have to change my whole presentation. So it's better for me not to have been here this morning. So it's better for me this way. And the content, the bullet points I'm going to be dealing is very swiftly on the issue of determination, the promotion of health. Also, this is what the program requests, health and policies and governance, meaning it's a confusion. It's hard to do or joining all the things together. But these things have to be brought together. We cannot work isolatedly on any of these items. And I'm absolutely certain that this morning, at least, a mention must have been made by Oscar, meaning we do believe, and there are a lot of evidence showing that health, and this is clear for us, it's not a biological phenomenon. Far away from this, there's a social production in health. And this social production in health is what gives birth to the social and public health situation we live in. Meaning those are positions, he says, of the social classes, positions in terms of production and consumption that do define the health situation of a family, of a person, and the society in general. Is defined and determined by social production. And what can we say is that the whole result of this type of scenario as unfair situation, unacceptable situations in every single dimension. This is a situation. I'm not going to say it once again because tomorrow the official representative of ECLAC will be talking about social determination in health in Latin America. So I think that supply data won't be necessary because she will do it tomorrow better than I can. And we try to work also kind of with the whole concept of social determination, which is a social process, political, economic, and cultural process that tries to explain this inequitable distribution of power and the conflicts between social groups that influence on health problems and risk factors for the population. It's kind of obsolete talking about conflicts between social groups, but this is so clear-cut. Also, Marx stated this over 150 years ago, and still it was being discussed, is there conflict? No, the situation is harmonious. Everything is fine. And people who are actually employees to make use of consumption goods. But this is very clear too. And this is a focus. And the backlashes depends on the whole distribution, inequitable distribution, and also conflicts in different groups. It degenerates health problems, and these are risks for the population. We see with significant reduction in inequalities, in economic, social inequities, it will be impossible to reduce the inequalities in healthcare. And as far as we talk about inequalities, equality, and equity, Juan will mention this much better than I can. In terms of, it will be kinds of class, a whole discussion. The approach of social determinants depends on intersectoral activities. Actually, the invisible hand of the market. This is recognized also by the most conservative, of the most conservatives of the conservative economists. When the Washington Consensus was proposed after years, actually, also, the consensus of Washington repudiates so many diseases or deaths and so much infortune. And now they said the fact that the invisible hand of the market won't solve the problem. The social determinants that depend also basically in its solution on public policies and intersectoral actions, which is exactly the issue of this course. And of course, at the same time, there are global actions, the social of determinants, and also we have to think that social determination is part of the interconnections in terms of health and development. And where is the origin? The origin is the format on production and consumption that is imposed on us by capitalism. Capitalism, with its modern ways, always has been, but increasingly more, actually generator of different inequalities within the capitalistic development. Capitalistic development generates actually societies with so many inequalities and inequities, be it now capitalistic development and its regular crisis, in order to actually displace the power and the money. Also, those are not just natural things that can happen, as economists like to sell the idea. But capitalistic development and its regular crisis are these situations that had shaped historically the world, which is deeply unequal among countries and social classes and groups within those societies. Also, we're not talking about social classes anymore. Social class is something that has to be abolished from our conversations. And this is an error because we cannot clarify actually the interventions that we should actually organize as public policies and as public health policies. And clear example, we did the general crisis in 2007 and 8 also in the US and Europe. More developed countries, this capitalistic development process understands a relocation of the capital, relocation of jobs and labor, and this is part of this regular crisis. But today we say that this crisis that seems have to happen in a regular basis basically a structural crisis. We don't know if we're in a structural crisis now, or it's in fact a regular crisis, a conjunctural crisis. But once again, transformations that await us are deep, have absolutely no doubt about it. For example, yesterday, Greece has voted for another way of having relationships between Greece and the European Union. They were a different shape and format. Madame Merkel he has to think, how are they going to resolve the problem? He has goosebumps because the European Union is threatened, and the European Union is a political project of contemporary capitalism. So these are things that we are going to be seeing, and seems that we have nothing to say to that doctors is not a problem. A problem is TB, diseases, tuberculosis. No, we have to be alert. Who of us, those of us who work with public health, those of us who work with diplomacy in health, global health, we need to follow closely those processes that seem to be far away from our relationships and from our realities, from the fields of action, but it's not so. Well, and this society made by classes in the production model produces also exclusion, inequalities, and also they're eco-aggressive. There's that type of process from the capitalist development that we live that produces inequalities, exclusion of broad layers of the population. They are aggressive against the environment. This is a contemporary problem, and let's not believe that Rio de Janeiro has always been as hot as it is now. We have had better times in the past, and I definitely believe that we are living situations because of climate change with results which are very impressive that will be seen in the future. Loss of biodiversity will be seen in the future with consequences on human health, negative consequences on human health. Oh, please don't doubt the fact that it depends on the production and consumption mode that we live today. So things are all interconnected. And an example of these inequalities and exclusion factors is that information from the World Bank and from WHO show that 84% of the global population and 92% of the burden of disease is located in the developing countries. There is a disconnection between the burden of the population and the burden of the disease. Also, they say also that we have 29% of GDP is in the developed countries and only 16% of expenditures in health. There is neither relationships between GDP and expenditures or investments in health. And we have 80% of the poor people are in this region. This shows inequalities, and we now could make hundreds of calculations of data showing exactly the same thing. Actually, we could do it, but it's needless to say it. It's better for us to advance in a discussion still on the issue of determination. Determination actually has historic roots in the history of human society since
from Gears or Chadwick before, from the origins of capitalism, 1850. The studies are conducted on this topic of social determination. Engels have spoken a lot, Chadwick, again, Villermay, and many other academics. But the most recent periodization, the topic on determinants, which is different from determination, has been mentioned in its relation with health since Alma Ata in 78, then Ottawa, making a connection with the promotion, determination and promotion, Ottawa 85, and other conferences about promotion. Because in promotion of health, when we refer to promotion, prevention, treatment, and recovery of health, we have promotion, and in promotion we include the topic of determination and the solutions and health policies. There is a rationality that I would like to call the attention on. So the topic on determination has been mentioned since Ottawa and other conference, of course, with theoretical conceptions which differ, which is not determination, but there are other phenomena. and the causes. In between 2005 and 2008, the WHO Commission was organized on DSS, social determinants, and according to our proposal, it was representing Brazil. And in the executive board of the WHO, we have the Rio de Janeiro conference in 2011. And we always have the proposal for action. We have to eliminate from the social causes and economic death and precocious diseases. And these are based on gender, income, basic sanitation, and other aspects. We are always working with the expression of determination, because if we go to the heart of the matter, we have the social structures, which are the ones which create inequalities, are the ones who maintain inequalities. So there's something that we have to mention. One thing, when we work on determination, the consequences would be this. And when we work on determinants, we are thinking about parts of a whole, but they are transformation of the social structure which create and maintain inequalities. Yes, we would be doing a final encountering more complete and more correct on the matter. All this discussion from now onwards, we are going to work with those two opinions on determinants, situations on determinants, because we will make an effort to determine where we are at the moment. Now, taking into consideration the topic of determination or determinants, there is a response of the health sector within what we call health promotion. Health promotion, there are different approaches, individual and collective ones. The individual ones are education, qualification, and communication. Promotion is education. Promotion is to change nocive conduct. This is something very strong, perhaps the strongest one, and one of the most central part of promotion is the topic involving tobacco, alcohol, education for transit. There is an individual approach. You behave like this, and this is not good for your health. It doesn't matter whether you are the victim or not of your behavior. If you are the victim of a social process that provokes this conduct in you. So there is always the guilt of the victim. When we refer extensively to the theme of education, the victim is guilty. There is a series of influences that end in this. There is a crucial question on this. But there's also a collective focus, which is together with the individual approach, they start with the Confederation of the Promotion of Health and the Ottawa Charter. When we have the second principle of health promotion, which are the public policies, healthy public policies. These policies saved the conference promotion of health in Ottawa from being an exclusively educational approach. It dealt exclusively of informational education. If you are not informed, you have to make decisions. If you are informed, you have to make decisions. If we don't work on a collective approach, promotion will not provide responses as we think this area of work has to provide the responses in the area of health. So we have the topic of healthy policies that which are also healthy cities. And finally, health in all the policies is like an evolution. In the second the Adelaide Charter, in Adelaide. This is very interesting. In '89, that means to say 4 years after the Ottawa Conference, a meeting on healthy public policies was proposed in Adelaide, corresponding to one of the principles. And since '89 to 2013, there is a promotion emerging from healthy public policies, healthy cities, and health in all the policies. This take place in 2010 when we take up again under another denomination, which is health in all the policies, taking into consideration the consequences of the public policies on health of the sectors that are not the health sector, of course. So we have the 8th conference on health promotion. So you see all these in Helsinki in 2013. We have the Helsinki Declaration that has health in all policies as the center of debate. This corresponds to a history within promotion. And in 2014, the World Health Assembly, we have a resolution, which is the contribution to the economic social development, the multisectoral sustainable action in order to improve health and equity. You mean to say you have a very good wine in this case and you add water. So the resolution is when we add water to a good wine. And don't you like the Rioja wine? That's okay. You don't like water, but the Rioja wine is excellent. This is the problem of the organization of the General Assembly, informed by the board. They add water to the things, to the decisions. In order to adequate everything, they add water to all the important decisions. The same happened with some very strong things in Almaty and in other opportunities. So what we work in health in all the policies, and we have this evolution and the discussion on this, an approach taking into consideration the decisions on health, that trying to seek for synergy and avoid the negative impacts from other sectors with the aim of improving health and equality. These are the definition of our PAHO in 2014. Many of the social economic determinants go beyond the health sector and their policies. It is necessary that the impact on the health be considered through sectors and at all levels of governance. This is the concept that we are using in the organization, the World Organization and the Pan American Organization. The approach of health in all the policies has to accountability, rendering of account, participation, information, sustainability, and multisectoral cooperation. And structures and intergovernmental organizations provide the support to health and all the policies, and the health sector has a central role in its promotion. This is the concept that is being used in health in all the policies. We have the topic field, the periodization from Almaty Declaration of the Millennium Declaration, and finally, the resolution on health for all the policies. This concept that is being managed by the United Nations and PAHO is based on promotion of health, 88 Almaty, and the Ottawa Charters, Adelaide Declaration 89, and the Adelaide Declaration on health in all the policies, when we take up again the topic of healthy cities, or at least public policy. This is present also in the Declaration on the Determinants of Rio in 2011 in Moscow. Not in Moscow, but the reduction of United Nations General Assembly on prevention and control of non-communicable disease and a declaration of Helsinki in 2013. And they say when it is allowed, the Declaration of Human Rights, the Declaration of the Millennium, and they are focusing that this topic of health in all the policies may play an important role in the process of development of the post-2015 agenda. This is true within the formality, within the bureaucratic structure that we saw. It's there. We have to make good use of it, but we don't have to be naive. We have to understand all these processes. Then, PAHO last year, and I'm referring specifically to PAHO because we are involved with the PAHO in our region. And in the board of the PAHO proposes a plan of action in health for all the policies. A plan aligned with the general plan of the WHO with 6 strategic lines to establish needs and priorities, and also how we would do it, planned action, defining instructions, the processes, facilitate evaluation, ensure follow-up, and strengthen capacities. Our countries approved this in the meeting, and they start now, well, September, October, November, December, January, February, March, April. 7 months after, it's not a lot of time, not a long time. I don't know if it is very slow, but for the slow movement of the United Nations, 7 months is nothing. I mean, 9 months newborn. So 7 was the technical. In April 25, I call the attention because perhaps some of you will be representing your countries in that discussion. And policies and health and all the policies have to go forward. It is important for those who critically have a position in relation to the process may be of great help to achieve better results. Which is the criticisms? What are the possibilities that we have in the topic involving health for all the policies? This is all together. This is united. Social determination, social determinants, health promotion. I don't know if I am being clear in giving you these ideas within the structure of the United Nations, where our countries are. This is a path. There are many others, but the choice that we did is to allow changes with critical attitudes. This is a neither idealized concept, because it ignores the political forces in conflict in coalition governments. Just to mention one of the problems. Health for all the policies, depending on governments, depending on how power is distributed among the governmental sectors. Who is the domineering force politically? Which are the covenants that exist to say that the economy or housing will be connected to our vision of health. It is within the sector, is it? In Brazil, I have the experience. It's coalition government, left wing, right wing. Dilma Rousseff, our president, goes from the right wing to the left wing. So depending on the person in the ministry will do or will not do the policies to incorporate the repercussions of health. This is problems of the coalition government, which we saw everywhere nowadays. But there is something important of health. You know, the policies depend on the conflicts between knowledge and teachers that form sectoral bureaucracy. This is a concept from Weber. Democracies have their explanation on reality on how to organize government and how to implement government. So when we read Weber theories, we see clearly that the sectoral bureaucracies are very powerful. They don't depend only on politicians. How this topic, the other topic is how this theme on organization will take place in parliament, in the policies with politicians, the party, and distribution of powers. Of course, the positive point is that there is a speech on the principle of rights to health and equality, but the reality of the political dimension exists. How it is distributed, how power is distributed in the government, among politicians, and within the society. When the social forces are interested, how are they interested in the principles of health in other policies? Well, of course, this mainly depends on governance, questions on planning and intersectoral action. This is when we see all this with a positive and at the local and national levels, including perhaps is the most important when we achieve, which is the social participation, and even better, if we could say the social control. Because one thing is participation, which water and wine. And when we think about democracy, participative democracy, that would be something which is nearer the control of society on the public policies. Well, what are we addressing when we speak about governance? We published a paper in the public health school. We published a paper. And this is a very long concept, but governance, in addition to the modus operandi of governmental policies that include questions regarding the political and institutional format of the decision-making process, the definition of an appropriate mix, the approach of the programs, but the concept of governance doesn't restrict to the initial aspects and managerial and administrative aspects of the state, and also not only to the situation. Governance is a very broad concept referring to articulation and cooperation standards among political and social players and institutional arrangements that coordinate and regulate transactions within and through the borders of the economic and social system, including not only traditional mechanisms of aggregation and articulation of interests, for example, pressure groups, political parties, but also the networks, social networks. Governance operates in a broader plan involving the structure of government, but also of society. So you have to think about and reflect about this concept, because it means to understand the distribution of power among the social players, the distribution among the government. Without an analysis of this nature, of this kind, it is like a dream to think that we are going to influence or to have any influence in the topic of public policies and health among them. So this kind of analysis has to be conducted seriously if we really think to work with this tool of health. It's a political tool and also an interventionist tool. Governance in health, I'm not going to discuss here, but let me take the concept of the paper that you received as a bibliography reference. But there are two concepts that I would like to discuss, because one of them is governance and health, which is split into two things: global health governance, and the other one is the governance of global health. When we refer to national governance, we mentioned that we had these slides, but I would like to discuss another concept of health, global health and global governance in health, which is, you know, they are different things. Global governance, and this we, well, after that, I will like to mention this now. Global governance and health is a group institutional mechanism, relationships and processes, complex ones, formal or informal, among states, markets, citizens, and intergovernmental or non-governmental organizations through which the global level collective entities are articulated, as well as legislations and obligations which are established and the differences are mediated. Health doesn't depend only on health. There are global and very powerful interests outside health, but that have influence on health. Some examples may be the very, very powerful group of the World Commerce Organization, WIPO, and many other important organizations just to see the system of the United Nations. We are now writing a paper
with something that's hard to say, but we say it, meaning that health is being resolved today within the rooms of conference rooms of CEOs of huge companies is not being resolved within the environment of WHO, not in the WHO. This is discussed in the WIPO and also WTO, especially is being resolved in the offices of the powerful CEOs of companies of huge international corporations. In Brazil, for example, the big hospitals, these health policies, the laboratorial diagnosis, those are funds, actually. Those are just funds that are handled by the finance people that are buying in Brazil the health services. I'm not referring to Coca-Cola company or that imposes actually food that we eat. This is very clear. We are handled, manipulated. This is not paranoia. This definitely actually on thinking clearly and stop being blindfolded. These policies are defined from outside. You have to understand it in order to be able to change our operation methodology in terms of promotion of health and public policies, where the other concept is global governance in health. We have the picture, a photo, as you can see down here, of where in the room or we see the WHO where the director groups are meeting. The group where we have 34 countries of the 198 who are members to this group. There's a smaller group definitely, where decisions are made that later are going to be going to be discussed in the World Health Assembly. Global health, and also we have rules and formal procedures or informal procedures by states and different intergovernmental institutions and non-state agents in order to deal with health challenges that demand collective and transborder actions. Be it the guiding body, actually, also it is the leader should be in WHO. But as I said before already, I'm not certain that this is so. But we need to have this our clear idea in mind. And kind of to say also that there are voices even from the establishment, like Stiglitz, Nobel Prize of an Economy of 2001, who says the price of inequalities, or they discuss globalization and its evils. I suggest buy this book, but it's a way of communicate yourself with someone like him. I'm talking about Joseph Stiglitz. So when I mention Stiglitz, people say it's Stiglitz who is saying it. It's a Nobel Prize winner. It's not a socialist or a communist. But he says things that are very strong and very important, very pertinent. We have to use also this. I think it's in his blog. This book is made available for free in his personal blog. I believe I had the opportunity of participating in a commission from the University of Oslo. You see where you can find the full text of the presentation that proposes a few things. Political, global, determinant factors on health, or what happens in the world outside the health sector in terms of governance, global governance and health, which are the political global determining factors of health. It's not bad. It's also there are things that can be challenged, but that's another story. The austerity measures, intellectual property, the different treaties, the general treaties on the business and their influence on health, actually food security, different transactional activities, illegal immigration. These are some of the political global determinants that were analyzed. I suggest also, please look at later, at leisure. It can be made available at the Lancet page. And also, well, other things too. I have only 10 minutes, so I want to talk for yet another 100 minutes, not 10. One of the international arrangements, once again, going back to it, is the Development Agenda post 2015. Is a global response after 2000. Actually, is organized by United Nations and its member states. I'll try to go swiftly through it. The debate on the agenda is important because necessarily actually is going to be influencing on national policies as it happened in many countries with the Millennium Declarations and the Millennium Development Goals. This is also a text that has been published in Public Health. I published this with Ilona. With the global agenda for development, there's summits and conferences. So the Millennium Summit with the Millennium Declaration, they call this as Development Program for the United Nations. The conferences were many. Also, conference on children, I don't remember, on childhood, environment, and development, the Rio Conference, human rights, actually population development, women in Beijing, well, the Social Summit of Copenhagen. There are many conferences that wanted to prepare the world for the 20th century that happened during the 90s. So we had the summit on the Declaration and Millennium Goals, and then the Rio Plus 20 after 12 years, and now we're preparing for after 2015. So those were conferences that had these characteristics. I'm not going to detail this. That actually prompted the declaration, something that you know. And if you want to go deeper into it, you'll have everything in my presentation. We reached to Rio Plus 20. It's going to be discussing after 2015 this document with the future that we want, that we have commitments. There's a commitment actually from the heads of state and government dealing with the incomplete agenda and other agendas too. Actually, health has 9 paragraphs, 138 to 146, and there are things that are very interesting, and others that are just a group of intentions that are not well formatted, that are not linked together. One is that our presidents do recognize from Brazil, from Colombia, and other countries, Argentina, whatever, that health is a previous condition, which should be the result, and it's an indicator of the 3 dimensions of sustainable development: the economic dimension, the social dimension, and environmental dimension. This is very good because it puts health at the center, at the top of the pyramid. So health is very important for all, for everybody. When saying this, you can see that they order us to work on social and environmental determining factors of health. It's a mandate from the presidents. I do confess to you that these 2 parts were we in Brazil had made an enormous effort so that our diplomacy could put this, include this within the declaration of Rio Plus 20 in the future that we want. And we did it because we were, I don't know, people were sleepy, I don't know, and it passed. I don't know exactly, of course, that we use every single argument in terms of social determining factors, but it's not something easy. It was very hard to crystallize because people wanted to work as ever with communicable diseases and non-communicable diseases, strengthening of the health systems. And there, yes, the universal coverage and the actual TRIPS agreement, access to medication, actually water pollution through chemicals, reproductive health, and also the and WHO is the guiding body. These are the paragraphs. And then you see the establishment of a whole process, a complex, as you can see, a complex process within United Nations system in order to reach a document is going to be approved or not in 2015. Well, there are many other things before that. Also, so we kept the Botswana consultation, and then in the high level, actually, meetings, and these people, all the global consultations say, well, the sustainable development goal should be to ensure healthy lives and well-being for all. This is wonderful as an idea. It's an advancement and an unbelievable progress because our brothers from the WHO wanted universal coverage in health, meaning in just a sectorial goal and goes against even the constitution of WHO from the year 48 ignored Alma-Ata and ignored a lot of things. So we had the example of people actually in global consultation said, gentlemen, ensuring healthy lives and well-being, this is a goal. Of course, it is necessary to have universal coverage too. This is the contribution, the goal actually of the health system, but not actually universal coverage. Better said, it should be universal systems, complete systems, because universal coverage can be, let's say, if you're going to take a vaccine, you're covered. But there are other proposals I will try to discuss with you. Let's say the whole process that is here, or even with this precedence, everything is reunited in the intergovernmental actually group actually in Beijing, and also we have finally an outcome document that has been approved within the last year's assembly in September, and that now is being debated in order to perfect it until September of 2015. Also 17 sustainable development goals have been already approved, and one of them is health. Each goal has targets and results implementation means. There's a total of 69 goals within the 17 goals. These indicators are being negotiated. A week ago was released by the group that is headed by this gentleman, Macroeconomics and Health, Jeffrey Sachs, who published a paper on indicators. He is very smart. He is a very smart guy. So here you see the goal, the targets, the objectives, the goals. The goal is to work on the indicators, which is the whole translation of the process. This document also is available on internet. Health has 9 goals and 4 goals for implementation purposes. Well, here we see the objectives that are poverty, hunger, food security, nutrition, healthy lives, well-being, and healthy agriculture, education, gender equality, water, air, energy, economic growth, jobs, employment, infrastructure, industrialization, innovation, reducing inequalities, amongst countries, human settlements, cities, production, consumption standards or patterns, ecosystems, certification, biodiversity, amongst others, would be actually the goals, actually. No, results, actually. And then we have two objectives in terms of implementation with that promote peaceful, inclusive societies, access to justice, and here different efficacious institutions improve governance, be it governance, global governance, and national governance, and strengthen also the implementation means in order for development. So who is going to be paying the bill? So this could cost a lot of money. So until 2030, who's going to be paying the bill? We are in a crisis situation. I don't know. The population of the European Union, Japan, China is not here, the United States, Canada are going to be able to actually more than 0.7% to dedicate to from the GDP, for international aid. There's some contradictions here too. Then, well, what are the goals for health and well-being? Maternal mortality, death of infants, and the issue of epidemics. These three are the Millennium Goals that are not yet fulfilled. Then we see as also non-communicable diseases, substance abuse, addictive substances, consumption of alcohol. I'm not going to go into the details because is actually we see there's a concept, a light concept between the agreement with companies and so forth for alcohol producers, traffic accidents, sexual and reproductive health. Here we have universal coverage, which is the proposal of the WHO. For WHO, we should put it here. But the people say no to the WHO. We have to put this here. And you try to do things here as a goal within this framework. Universal coverage in health, in especially protection against financial risks, meaning also going to be putting actually insurance. This is right to health is not mentioned. No mention to be made to be role to be played by public systems either. So I'm sorry. Access to health services, essential, and access to medication and vaccines, also these are essentials. Essential. This is another problem. And finally, you have to work on the environmental issue, chemical products, pollution, air pollution. And here you find the 4 implementation methodologies: tobacco, the framework agreement on tobacco, research and development of vaccines and medication, access to drugs and vaccines that are essential, increase financing, and resolve the issue of personnel and staff. And here we see epidemiological surveillance, basically for early alert. Work also with, for example, with Ebola. Nothing against, quite the opposite. Well, what is the criticism to be made? It's a pity that Alejandra is exerting pressure on me to finish. I wanted to have more time. The problems of the agenda are ensure actual well-being or universal coverage. I'm not certain that things are being resolved already. WHO exerts pressure to have universal coverage because it's going to be, but the sector will be getting money in order to finance actually these goals. And healthy lifestyle is the money. Well, I don't know. Was it even admitting universal coverage? The issue is universal coverage or universal systems. Universal coverage is a concept that starts from the system. But when we work on systems, we say universal systems, integrated systems, equitable and good quality systems. Is different from universal coverage as a concept in itself. Universal coverage and also documents that are being discussed talk about care. Also, actually care for patients or integrated care. What are we talking about? The other issue, the right to health or actually assurance of health is something that is being discussed within the whole concept, even though we are working on universal coverage. Assurance, actually non-financial risks. Schemes for assurance is a clear show of stimulating the private activity and not the right to health. This is very important. Then drugs and vaccines that are essential medication and vaccine. Also, remember, we are talking about packages. Brazil proposed changing essential, changing, actually replacing essential for necessary medication for the epidemiological or the health situation, and not essential. Essential is a whole package that we have. This is a package and that's it. No, essential medication is defined by WHO, but always with criticism made on this too. Well, the other topic doesn't mention actually medical technologies. Also, I don't know well if what I do here, but me, Paulo Buss, I don't know what I do, because medical technologies could be actually a new opening for business, but on the other hand, why should we have medication and vaccines that are essential if I do not have the materials for diagnosis and surgical interventions, and technologies are not mentioned? Is as if they didn't exist. Is a problem also that we have with the agenda.
On the other hand, we don't see public health or environmental health. That has not been considered. All the topic involving surveillance and health, the regulation of the companies is not mentioned. Exactly as the World Bank report in '83, when it proposed the packages and didn't mention at all the most important thing, which was the ability of the health system to, on behalf of the population, to regulate, which is the power we could have on the industry and the power on them, and the use of certain products. So this is very, very serious, and it doesn't say a single word on social determinants. There is not a single word when our presidents so they took their resolutions of the future we wish, and we have other topics against the Vatican, the question of the sexual, because the Vatican, I was here in Rio, they resisted. The resistance for using the term sexual. The Vatican understands a lot of reproduction health or reproductive health. There is not a single word on health and development and social determinants. This is very serious, and this is what Brazil proposed. In the topic universal health coverage through universal equity, comprehensive and quality health systems, the proposal was to include this: necessary and not essential, and public health services, because only refers to the topic involving individual services. Essential for necessary medicines and vaccines and medical and public health technologies for all. We also propose to add this. Then, in the topic regarding environmental health, in addition to health chemicals and air, and protect the health of the population regarding those threats. This is the possibility of environmental surveillance and of sanitation surveillance. And finally, to attend new item or a new goal to address the social determinants of health through innovative forms of governance that include other government sectors and civil society. In order to have coherence within the mandates that we receive from the presidents, I don't know what will happen, but this is the discussion that is taking place, also with our diplomats. And here, in the topics on implementation. Now, I will now go through this very quickly because I cannot speak any longer. And if you wish for me to speak about this, please ask me. So, this is a technique, a person. There are very many slides which are very, very, very good. So if you wish, you can ask about them. I can speak about all this. Thank you very much.